If you are a caregiver to your child with autism, you might experience moments where your child behaves in ways that are difficult to manage. Certain triggers might cause your child to display challenging behaviors that can be self-injurious or harmful to others. It is important to know that challenging behaviors are common for children with autism. These behaviors are often your child's ways of expressing themselves and their needs. Therefore, to better manage and possibly prevent challenging behaviors, we should start by understanding these behaviors first. So for today's topic, we will be discussing the 5 most challenging autism behaviors that your child may engage in and what you can do to manage them. Number 1. Physically challenging behaviors. Physically challenging behaviors are described as an act of force that may cause harm to another person and might include hitting, biting, grabbing, or other aggressive behaviors. Number 2. Emotionally challenging behaviors. Emotionally challenging behaviors include aggressive shouting, meltdowns, and tantrums. Meltdowns and tantrums are described as emotional outbursts that might involve crying, screaming, yelling, and stubborn or defiant behavior. A child may lose control of their physical state and may have difficulty calming down even if the desired outcome has been achieved. Number 3. Self-injurious behaviors. Self-injurious behaviors refers to someone causing physical harm to themselves. Self-injury can present in a wide range of behaviors including head-banging, hitting, punching, or biting oneself. Number 4. Pika. Pika is a disorder where individuals consume non-food items. Some children with autism and other developmental disabilities eat items such as dirt, clay, chalk, or paint chips. This can become self-injurious when a child with autism eats potentially toxic or sharp objects. Number 5. Non-compliant behaviors. Non-compliant behaviors are described as when a child with autism does not or refuses to follow the directions given by someone else. It is common to see meltdowns and tantrums occur when a child with autism refuses to comply. Behaviors can arise due to triggers. In children with autism, it is especially essential to be aware of the possible causes behind their behaviors. Your child with autism may behave in challenging ways because they possibly are finding it difficult to understand what might be happening around them. Certainly, they will find difficulties expressing or communicating their needs, which often leads to frustration or distress with what is going on around them. In children with autism, challenging behaviors may also be caused by specific triggers such as a change in routines or unfamiliar situations, transitions from one activity to another, inability to communicate their emotions, sensory overload due to light, sounds, colors, tastes, and textures, and lastly, tiredness, discomfort, or pain. With that, you may wonder how you can help to manage your child's challenging behaviors in order for them to be aware of their surroundings. Number 1, observation is key. Being aware of the causes behind your child's behaviors is the first step to managing them. You can identify them by keeping a journal to note down instances of difficult behavior and possible causes. Some questions to keep in mind are: what was happening before the behavior occurred? How did your child display their behavior in reaction to this specific trigger? What happened after the behavior was displayed? Number 2, make the necessary adjustments. Once you have identified the causes, you can use this information to make the necessary changes for your child. For example, create a routine for your child through the use of visual schedules or picture timetables. Prepare your child for changes in routine. For example, verbally remind them before each transition to a new activity or show pictures of the next activity or place. Communicate clearly with your child. For example, make sure your child is paying attention when you tell them what's going to happen. Use language, symbols, or pictures that your child understands. Here at ARN, we provide programs that involve parents and caregivers to help you on this journey. If you have further queries, do contact us through the information on the screen and support us by liking this video and subscribing to our channel so that you can be notified when the next episode drops. Until next time, bye!